Dr. William Mustard's lifetime of surgical innovations began in 1944 while serving in the Canadian Army Medical Corps, where he used a prosthetic glass tube in a wounded artery to save a soldier's leg. Back in Toronto after the war, he continued to build a reputation as one of Canada's great surgical pioneers.
Dr. Mustard was a remarkable man because in that era, which was over 40 years ago now, he was able to practice in two specialties, orthopedic surgery and cardiac surgery, because both of those fields were just getting developed at the Hospital for Sick Children at that time.
He cared about children so much, and they loved him. They just felt so at home with him, with his sense of fun, and he was a small man physically, and they didn't feel like a giant was handling them when he was dealing with them. But so he really enjoyed with the orthopedics. There were things he could really do. He could help these kids, particularly in the polio years. He had so many then that wouldn't have been walking without his operations, and he loved that he could give them a normal childhood.
He developed an operation on the muscles around the hip joint in poliomyelitis, an operation that was very effective. So that was known as the Mustard operation in orthopedics.
As far as I know, he's the only doctor worldwide that's had two totally separate procedures named after him, the Mustard procedure, one in the field of heart surgery and one in orthopedics, and that's really unusual.
As a cardiac surgeon, Dr. Mustard devised an operation to correct an inborn defect in blue babies.
The problem the children had that his surgery corrected was that instead of the blood circulating through the body in a figure 8, it went around like in two circles, so that the blood was just kept going around to the lungs and getting oxygenated, but the blood going to the body wasn't picking up oxygen, so it was blue, and that's why they called them blue babies. Instead of trying to correct the heart back to normal, his operation made the heart sort of work backwards. Instead of the left ventricle being the main pumping chain, the right ventricle was. But in children that didn't matter because they hadn't yet developed the large ventricle that an adult would have on the left side from all the pumping over the years, and the right side could do it. But it was an intriguing, ingenious kind of solution. Others everywhere had been trying to put the vessels back in their proper places, and it couldn't be done. So he had, again, an insightful way of fixing this problem.
He had a great deal of insight. He had a very inquiring mind. He did good basic research. He was a superb technical surgeon, very wonderful surgeon to watch work. It was just like watching ballet. I mean, to see him operating, it was just marvelous. And he was a very innovative investigator, that is, a researcher, a stimulating teacher.
He didn't like pomposity or stuffiness or conceit in anybody, and particularly not in doctors. He thought it was too often that they seemed to think they were demigods or something that were just above everybody else. And he had wonderful ways of knocking this stuffiness out of people. Teaching his students, just in the middle of a lecture, he might stand on his head, just to, as he said, get their attention, lighten things up a bit. His father had a deep philosophy that Bill held tightly to, was that it's not what you get, it's what you give to your community that makes you rich.